if you have extreme volume loss, is that best fixed by a facelift? Hi, Dr. Imber. Good question. If you have extreme facial volume loss, that's either by losing weight with an Ozempic-like drug or aging alone or diet. But if you have extreme volume loss, is that best fixed by a facelift? Well, the answer is probably no. Maybe a combination of ingredients. The first thing to do for volume loss is to add volume. And we don't do that with filler because the more filler you add, the less natural it looks. It becomes filler face. But if you add fat as a filler, your own fat, it's natural. It never looks overdone. And a large percentage of what you inject is permanent. So if you've lost volume in your face, the first thing to do is to consider adding volume with a fat transfer. Very often, people who have lost volume in the face are in the facelift age group. So we do both the facelift and the addition of the fat for volume. If that's the case, what I traditionally do, and I've had to explain this to a lot of patients, is first I tighten the skin, then I add the fat as the facelift is finished. So um, everything is put back into place, and then through the incision itself, we insert through a long cannula fat wherever it's necessary, particularly over the cheekbone area and the hollows beneath it, wherever the volume has been lost. You don't need a facelift to do it, but they're usually done together.